everyone. My name is Hope. I'm from Kokua Mau. I'm the Advanced Care Planning Coordinator. And we're happy to be here to talk today about advanced care planning and why it's so important and the documents you need to support you throughout your healthcare journey. So a little bit about us. Our Kokua Mau, we're a 501c3 nonprofit organization. We actually are celebrating 21 years. Last year, we kind of, it was a give because it was 2020 and nothing was happening, but we've been around for 21 years now, and we are supported by our members, and our members include health plans, hospitals, long-term care facilities. We have home health agencies. We have a bunch of churches and temples that actually support us in the work that we do, including hospices. Navian's one of our members as well. And we have individual supporters, and they see the work and the value in the work that we do, and they support us through membership. So if you'd like to become a member, we invite you to join our movement to improve care. I get the joy of working with passionate volunteers across the state. My volunteers, we call them ambassadors. They consist of nurses, I've got social workers, I've got doctors, I've got retired employees of health systems. I have a bunch of people who are passionate about this work, and they have seen what happens when advanced care planning is not done. And so I am happy to have them in our circle as our ambassadors supporting Kokua Mau. Our 3 areas of activity is that we work with people who may be facing serious illness and their loved ones to understand the decisions they may be faced with as early as possible. We provide professional networking and training, and we also dabble in policy and legislation. So with the 3 areas of activity, I'm just going to ask you, I know I can't see you all, but if you would just think to yourself, have you thought about how you would like to die? And my guess in the experience that I've had out there is that most people say either in their sleep or quite quickly. The truth about that is that only 10% of the population goes out like that. So that means the 90% of the rest of us, we have some planning to do. So this is why advanced care planning is really important to do with healthy individuals as well as individuals who are facing serious illness. So we like to consider ourselves leading a movement, and that movement is to make advanced care planning, open communication, and talking about this, including end-of-life care, a cultural norm. We want people to be comfortable talking about their wishes for care and thinking about it while they're still healthy, rather than waiting for a crisis. We all know that decision-making in crisis mode sometimes isn't the best and well thought out way to make decisions. So we're hoping to change that and get people talking about this as a cultural norm. We do enjoy humor. And for those of you who maybe the font may be funky, because I do realize the font is kind of funky. It's just so you know, I never want to live in a vegetative state dependent on some machines. If that ever happens, just unplug me, okay? And of course, she unplugs the TV. So I'm going to ask Debbie to bring up our poll. And the poll has 2 questions on it. There we go. So the 2 questions, if you could take a look, do you have an advance directive that names your healthcare agent? And if you do have an advance directive, when was the last time you reviewed it or updated it? And so Debbie, I can't see the poll, so when we hit 50%, I guess that's kind of good. 50 to 75%. Again, you got it?
Yes.
All right, if we can see those results. Okay. I love it. Someone was honest. What's that? All right, we're going to get into this with you folks. For those of you who have that advance directive, awesome. This is possibly review. Maybe you'll want to update it. For those of you who aren't sure or don't remember, we're going to go into that. And thank you for voting and participating in the poll. Okay, so today's goals, we're going to be talking about the importance of advanced care planning and having, we talked a little bit about our Let's Talk Story program. We're going to talk about having the conversation and some tools that you could use to facilitate having these conversations. And then we're going to look at the documents that support people for their wishes for care, including the Advance Directive and the POLST. We'll dabble, if we have enough time, on what's hospice care and what's palliative care, but I think Debbie's intro did a great job on that. But we'll circle back on that if we have time at the end. So what is advanced care planning? It's an ongoing process. It's talking about, it's thinking about, it's writing down, sharing your wishes. This is something that we are encouraging all competent adults over the age of 18 to do. We're not encouraging you to wait until there's a healthcare crisis, although sometimes that's what happens. But we're hoping that we can get people to start talking about this and thinking about this earlier, so that when it comes times to make challenging healthcare decisions, there has already been some pre-work done so that you have an idea of what you would want and what you wouldn't want. And Debbie, feel free to jump in if you think there's a question or a chat that might be important. Okay, so why is it important? So advanced care planning, okay, obviously COVID has changed the way everything happens out there in the world, right? So it's changed the way we get healthcare. You may, if you've had to have doctor's appointments, you may have had telehealth interactions now. It also changes the way people are allowed to visit loved ones in the hospital. That's kind of changing, but it still has some limitations depending on what facility they are at. But no one really knows when they're going to become very ill. For you out there, of course, I can't see you, but who plans on getting dementia? No one plans for these things, right? We want to be able to be prepared for these things. And advanced care planning really is an opportunity to help your companions and your loved ones to find your voice. It eases the burden for them so that they know your wishes for care if they need to make tough choices. And it helps to ensure that your wishes are followed. So during a hurricane, what do? Well, they say there's a hurricane coming. We go to Costco's or Sam's Club, we pick up bottled water, we make sure we have batteries, we make sure the tank on the gas tank is full, maybe refill medications. We take action, right? We're never sure whether that hurricane is actually going to hit us, but we take some sort of action to be prepared for a storm that could possibly hit. Why don't we do the same for our own mortality? Why don't we get prepared for this? And so that we've stocked up on the things that we know are important, and we've shared that information with our loved ones. So some key considerations about advanced care planning. One of the reasons it's really important is to anticipate common aging-related life challenges. So things like dementia, I mentioned that earlier, kidney disease, stroke, falls. Life happens and illnesses happen. So this is an opportunity to anticipate these possibilities. Planning ahead really minimizes the stress. It also helps with financial planning. It helps with family infighting. It quells that. It makes sure that family is able to be there and support each other because they know what's important to the individual who's facing a health crisis. They don't get to know that just by guessing. So we have to do some work in order for them to be able to support you during a serious illness. Legal documentation, we're going to talk about it a little bit. Oh, and I'm sorry, I have the wrong date on there, but it helps so that all interested parties can actually know how to support the individual with the health crisis. So again, we do enjoy humor because communicating with dead people is easy, but communicating with living people, well, that can be a challenge, right? So one of the tools that we passed out earlier that I asked Debbie to send out to you folks is from the Conversation Project. And the Conversation Project was actually created by Ellen Goodman, who is a Pulitzer Prize-winning writer. This is her mom. She had thought she had all these great opportunities to talk with her mom about how to age well, how all the good things in life. But when mom was diagnosed with early onset dementia, she realized very quickly that she hadn't talked about end of life challenges or decisions. And so she developed the Conversation Project starter guides, which should have been sent out to you. And really what the Conversation Project is, it's a public engagement campaign, and it's dedicated to ensure that everyone's wishes for end-of-life care are expressed and respected. If you've ever thought about where you want to die, oftentimes I'll have people in the audience say they want to die at home. Well, the Conversation Project actually did a survey, and the people that they surveyed, 70% of them want to die at home. However, 70% are still dying in a hospital. So somehow they're not getting what they want. These people, they're wanting one thing, but they're getting something else. 80% of people want to talk to their doctors. However, in Massachusetts, only 17% of people actually did. California, only 7% of people actually did. And 90% of those people who were surveyed think that these are important conversations to be had. So a few years ago, Kokua Mau actually did a survey, and you may have gotten a call from us. They were asking these same questions if people were having these conversations with their doctors. And 30% of people here in Hawaii self-reported and said that they are having these conversations. So while we're above the national norm, which is great, we still got some work to do. So how do we do it? Well, we want to have these conversations. And so the conversations start with you. Some of the tools that we have available from the Conversations project are here, and they're listed. The conversation guide is the most used one, but they also have these additional tools. Talking to your healthcare team, for caregivers with people with Alzheimer's and dementia, how to choose your agent and how to be an agent. And for caregivers of children with serious illness, they also created and developed this new workbook of what matters to me. And it's a more in-depth look at what kind of things are important to you as you face a serious illness or as you plan for aging. So Woody Allen has a great quote, "I'm not afraid of death, I just don't want to be there when it happens." And we're going to ask you, when you go through the starter kit, to really give it the appropriate, the adequate attention. You want to make sure that you give it enough attention so that you're able to be in that moment to answer these questions. When you decide to share your answers with others, make sure that you carve out some time, some quality time, so that you have an opportunity to have a really good discussion about your wishes. So the starter kit, the first part of it, it's going to ask you to think about this. What matters to me at the end of life is. So I'm going to take just a moment for you to go ahead and think about that. You can feel free to close your eyes if you'd like. Maybe just stare out at something. What matters to me at the end of life is. Where would you be? Who would be there? Are there sounds in the background? It's a really deep question. What matters to me at the end of life is. This Wordle, it actually was those people that were surveyed, they were asked that same question, and these are the themes that came back. Notice the largest one there, that's the one that was answered the most, was peaceful. With family and friends, comfortable, happy, laughter. Notice there's nobody saying that they want to be in pain. Nobody's saying that they want suffering. For the most part, people would like the death experience to be as positive an experience as possible. Not just for themselves, but also for their loved ones. So what matters to me? I want to say goodbye to everyone I love, have one last look at the ocean, listen to some 90s music and go. Well, for me, that sounds really cool, everything except the 90s music, but feel free to put in whatever era music you want to put in there. But actually that sounds pretty not bad, right? Having my sheets untucked around my feet. So I like to share that one because when my mom found herself in the ICU, I observed her every time the nurses came in and they tucked the sheets in around her feet. She'd spend the next 10 minutes doing this, trying to kick the sheets off her feet. I finally put up a sign behind her and it said, "Please don't tuck my feet in. I like my feet uncovered." The nurses really appreciated that. So they knew not to tuck it in, but I'm pretty sure mom appreciated not having to spend the next 10 minutes trying to untuck her feet. So what matters to you, it's really important to share that with your loved ones, to make sure that they know how to support you. The starter kit very painless. There are, I believe, 9 questions total. This is a sample of what you're looking at when you're looking at the questions, but you'll notice it's on a sliding scale, right? So as a patient, I'd like to know only the basics about my condition, or I'd like to know all the details about my condition. And you might be somewhere in between. But again, it's 9 questions. Really, it's looking at how you would like to receive information, your thoughts about how you would like to be treated, and an opportunity to really think through these things. Probably some of these ideas are things that you may have never thought of as well. When you're done with your starter kit, who do you share these answers with? Who would benefit from knowing your answers? I say anyone who would show up for you. That's your people, that's your tribe. Usually that's your ohana, but oftentimes it could be friends, neighbors. So who would you want to share this information with? Whether it's your parents, your children, your siblings, your spouse, your partner. These are the people who would benefit from knowing your answers. And also, I'd like to encourage you to set a date as to when you'd like to have that conversation. When you say, let's talk soon, remember, soon is not a date. So when would be a good time to talk? Put a date on it. A few years ago, we had Reverend Rosemary Lloyd come and talk to us, and she actually shared a story about, she was doing a series at her church about end of life through November. And one of her challenges that she told the audience, her parishioners, is to have these conversations. And so one of her parishioners was so excited. She shared her Thanksgiving invitation, and it said the time, the date, and at the very bottom it said, there will be no pie until you tell me how you want to die. And I thought, what a great idea. It's not threatening. It's not focused around somebody with an illness. And it's at a time where people are coming together to appreciate and give thanks and just be with each other. So when would be a good time to talk? Set a date to it and make sure you stick to it. Some people say, well, I want to talk about this, but I'm not sure how to. I like the very first icebreaker on this. I need your help with something. Can you help me with something? As humans, we're inclined to want to help each other. So when you ask somebody who's been reluctant in the past to have this conversation, if you ask them for their help, oftentimes they're likely to ask, how can I help you? It's a nice segue into opening that conversation. And when you open that conversation, I encourage you, if you are wanting to find out their answers, share your answers first. Share what matters to you. Don't ask them, hey, mom, I know you're close to 80 and I think we should talk about something. Rather than that, turn it around. Turn it around and say, hey, I had this webinar that I went to from Navian, and Hope from Kokua Mau, she talked about this. Can you help me with this? I'd love to share what I learned. It's an opportunity to share. And I really do encourage you, if you're looking at this as a means of finding out loved ones' wishes, start with yourself so that you have a means to relate with them, so that it doesn't feel centered on them for their age or for their illness. Start with yourself so that it sounds normal and something that people do, even when they're healthy. An additional tool I want to share with you is called the Go Wish cards. The Go Wish cards, they're free to do online. Most people enjoy the cards. When we're in an in-person setting, we have the cards and we share them. Unfortunately, we are in this virtual field. But the good part about this virtual world is that you can go and do the Go Wish cards online. So you can do this activity online. And it's kind of a game. And in that game, what you're doing is looking at the cards and putting them into subgroups. So you're going to decide what's really important to you, what's somewhat important, what's not so important. And if you look at the cards, it has a few ideas that you may not have thought of in the past. And this is what the digital version looks like. So while I can't share the tactical cards with you, I can share this game with you, and I encourage you to go and do this. You have the opportunity at the end of the session to actually print out your answers. I will tell you, these Go Wish cards are very helpful when you're trying to decide or determine what's important to somebody, or even what's important to yourself. So my husband's uncle has been facing some health issues, and he asked me to go and talk to him. And so when I went and talked to him, I took the Go Wish cards with me, and I asked him, to tell me what's his most important cards. And it was very interesting because he had a lot of cards, and I didn't want to cut him down to 10 cards like the digital version would, because they were all important because he's in the middle of a health crisis. So I brought the cards, I took the cards, took a picture of the cards, and I shared it with one of the sons. The son said, please share it with my mom. When I shared it with uncle's wife, Auntie, Auntie was like, why is this important? Why is this important? That's not important. Why would he say that's important? What was happening was there was a breakdown of communication, right? So while what she thought was important wasn't necessarily as important to him. So it was a great opportunity for them to connect and have that communication so that she could understand how to support him and he could actually get the support that he was looking for. So I encourage you to go and do the Go Wish cards as well. So when should we have these conversations? Well, again, for our movement, we're trying to normalize these conversations. So we're encouraging folks to have these conversations right out of high school. Start having those conversations while folks are young and healthy, so it doesn't seem like such a scary conversation to have. And then revisit it, whether it's every 5 years, every 10 years, after a life event. So whether it's college, going off to college, getting married, having children, getting a divorce, a death in the family, come back and review it. I actually had a social worker come and tell me, thank you for having me review my advance directive, because my ex-husband was listed as my agent, and my new husband would not be very happy with that. So it was an opportunity, and we do encourage you to, it's not a one and done conversation. Have these conversations throughout life. And especially once you're diagnosed with a serious illness. Hopefully it's not where you start, but if that is where you're starting, then these are some tools to help you navigate what's important with your decision making. Some tips for talking with your loved ones. You want to make sure that you have more than one conversation. Ideally, when you're having these conversations, it's your opportunity to figure out who your healthcare agent would be, who the person you choose to be your healthcare power of attorney. I also refer to that person as your champion, as your advocate. This is the person that aligns most with what your wishes are. And that's the idea. When you're having these conversations, it's an opportunity to figure out who you could trust to be that person to speak on your behalf if you're unable to. It's also an opportunity to delve deeper into some themes. Sometimes you'll hear people say, you know what, please keep me at home. Please don't send me away. Keep in mind, home is not always feasible. And it's really important, if that is a theme that is actually discussed, go deeper, because there may come a time when it is not feasible to have someone at home. It's just not possible. There's not enough support in the family or close enough by to help support the individual. Dig deeper and decide, and have that conversation. Well, if we can't have you at home, what can we make sure that you have that would make it feel like you're at home? And we'd be sure to come and visit you. This is an opportunity to really explore people's wishes for care. And if somebody says, you know what, just pull the plug, dig deeper, determine what they're thinking about. And what kind of plug are we pulling? What is this? What are the circumstances surrounding this? When did you want me to pull that plug? Have deeper conversations. This is a really good opportunity. So your next steps as an audience is to go ahead and have these conversations, work through the tools that are provided, whether it's the starter kit and the cards. If you can do those both, it gives you an idea of what's important to you and what you would want to convey to your loved ones. And then share your answers, share your decisions, share what matters to you. I actually have a classmate who, her sister was a nurse, and as a nurse, she knew exactly what she wanted and what she didn't want. And when sister was diagnosed with stage 4 cancer, the family was having a lot of infighting because sister knew what she wanted, but nobody could get on board with what she wanted. So my friend asked me, what do I do with this? And I sent her a copy of the starter kit. And I told her, I said, do the starter kit, but don't do it surrounding sister with the cancer diagnosis. Everyone share their answers. And so she called me up the next day and she said that was the best 2-hour conversation that our family had had in the last 6 months. I really, really encourage you to use these starter kits as a relationship building tool. It can help bring your loved ones together so that you can all support the individual who needs support, and also so that you can relate better with each other and know better about each other. And encourage you to share what you've learned with your friends, with your families. We encourage conversation, because really, if the unexpected happened, who would speak for you? When they know what you want, or possibly what you don't want. And oftentimes I'll have kupuna say, oh yeah, my kids know what I want. Oh, great, so you've had this conversation? Well, no. Okay, well, how do they know what you want? Oh, and that kind of makes them think about it. So remember, you need to have these conversations, because really, it's much easier to figure out what you don't want, starting with what you don't want, than what you would want. Because most people say, oh yeah, let's try things. But what would you not want? And so, did you know everyone over the age of 18 should actually have an advance directive that appoints your healthcare agent? Without that advance directive, a lot of time could be spent trying to figure out who's in charge. Here in Hawaii, there's no next of kin hierarchy. So just because you're married, it doesn't mean that your spouse is automatically in charge, or your adult children are automatically in charge. There is no next of kin hierarchy. There's no, I'm married, so, or my brother is, or my sister, or my oldest son. It doesn't automatically default to that. What they do here in Hawaii is they will actually call a meeting. And they call a meeting of interested parties, which means blood relatives, non-blood relatives, people who actually care about you. They ask them to come together. And in that group of people who care, they ask someone to be in charge. Now, if you have a big circle, imagine how hard it is to determine who's in charge. If you have a little circle with really opinionated people, it could also be a challenge. Really, what you want to do is avoid this part of it, because if people can't agree with each other on who's in charge, then the next step is to go to the guardianship case. And that could actually take 6 months and a lot of money to resolve. So save your loved ones that heartache, give them this gift, and name your agent. It really is a gift. Name your agent so that they know who's in charge. So advanced care planning, it really is a type of good planning. We plan for personal planning, health, personal, legal, financial. I have kupuna who are so excited because they've got their estate planning and after death planning and their will and all of that great stuff already done, but they still have to get there, right? Something has to happen in order for us to utilize your estate planning. So this is just one more step that folks should do in order to ensure that they are planning well. Without advanced care planning, we're looking at crisis-driven care. We're looking at decision-making that oftentimes are reactive or unplanned for. We're leaving it up to our loved ones to kind of figure out what we want, right? And sometimes it's not necessarily accurate. So that could also be a risk of providing unwanted care. So this is one of the reasons that we want to ensure that you have that opportunity to do that advanced care planning so that your loved ones know how to support you and what you would want. Stephen Hawking here. I'm not afraid of death, but I'm in no hurry to die. So our advanced healthcare directive, we have a free version to download on our website. It's at kokuamau.org. You may have gone to a lawyer and they may have included this. Well, what we are encouraging you to do is to do it yourself. If you go for estate planning and they offer you your advanced healthcare directive, by all means, it's up to you if you'd like them to do that for you. But I'd like to tell you that they will include that as the bottom line bill. So it's up to you if you'd like to save yourself some money. You can do this and you can keep it. It's as legal as a lawyer's version. So the advanced directive, in order to complete it, you have to have sound mind. So folks who are dementia planners, I encourage you to go out and do this now, because once there's a question of capacity, that could come into play when people are looking at your advanced directive. Really what the advance directive does is a two-part form. So one, the first part is it names your healthcare power of attorney. That's also called your agent, the champion, your person. This is the person that's in charge when you're unable to speak for yourself. And then it gives them instructions for for future choices, or as well as your end of life decisions. So in some cases, people aren't ready to do that second part of that form. That is perfectly fine. If you do an advance directive and only name your agent, you are still doing your loved ones a favor and giving them that gift. It is okay to complete your advance directive without completing your instructions for end of life decisions. So the first section, again, we're looking at who's that person that you choose. Hopefully you figured out who that person is through your conversations and sharing your wishes, because you want it to be someone who's familiar with your personal values. You want to be sure that that person is willing and able to make decisions on your behalf. And it doesn't need to be a family member. You can choose a friend. You also want to select your alternate so that you have a backup in case you're in a car accident with your person sitting next to you. You want to make sure that you have a second person who's able to step up and speak on your behalf if your first person is not able to. So end of life decisions is the second half. Remember, I told you there's two parts on this document. So the first part is naming your agent. Second part, this is what we're looking at. Oftentimes in the past, people referred to this as your living will. Well, the living will and your advance directive are slightly different because living will doesn't always include your agent. So if you have a living will, I would encourage you to update it so that you do an advance directive. So you name your healthcare agent as well as reviewing it and seeing if it's still what you would like. For your end of life decisions, usually when your healthcare agent when this document becomes effective is when I've lost the ability to communicate my wishes regarding my healthcare. And it's unlikely that I'll ever recover that ability. Or I have an incurable or irreversible condition that will result in my death. Or if the likely risks and burdens of treatment would outweigh the expected benefits. This is when they're actually going to refer to the document and what was written in the second part of it. The first section is whether you want to prolong or not to prolong life. Now, I like to stop and kind of slow down when I come through this, because there's two choices, right? I want to stop or hold medical treatment that would prolong my life, or I want medical treatment that would prolong my life as long as possible within the limits of generally accepted healthcare standards. That's a long sentence. What does that mean? So if you're looking at these two options, I want to stop or hold medical treatment that would prolong my life. Basically, it's saying, you know what, I'm good. Let's keep me comfortable. I'd like to be in the home setting or wherever they call home. I'm not trying to extend my life through medical intervention. The second section is saying, hey, I'm okay with trying all these new things. And generally accepted healthcare standards, what that could look like, if you've ever visited someone in the ICU, those are generally accepted healthcare standards. So you could be one or the other, and this is a personal decision, but it's an important one that you should really consider, because this could actually determine where you are when you're receiving care. And keep in mind, if you choose the first one, I want to stop or hold medical treatment that would prolong life, it doesn't mean they're not going to care for you. It just means let's not do these medical interventions that could cause me discomfort, or I need to be in a hospital setting. Let's consider my other options, which could be, well, let's consider hospice. Or you may be one of those that want to go into the hospital and try everything. That's fine as well, but you want to know which one you are so that your loved ones know how to support you with your decision making. So part two of section 2 is about artificial nutrition and hydration. It's important that we discuss this because here in Hawaii, culturally, food is love. We share food with each other, and this is part of our culture. We're the home of the mixed plate, right? So we like to share food as a means of showing our aloha for each other. Anytime you go to a luau or a baby party, wedding, celebration, you always hear, take some food with you, right? This is how we show our aloha for each other. So really thinking about artificial nutrition and hydration is your opportunity to make this decision and not asking your loved ones to do this for you. So keep in mind, artificial nutrition and hydration, the way that it's done when you're in the ICU setting is, and mom, because she had Parkinson's and she was in the ICU, her Parkinson's medication, she hadn't taken it. And because of that, she wasn't able to swallow because Parkinson's actually affects the swallowing ability. So she hadn't had her medication, so she hadn't eaten. So she was getting quite weak. She was able to still drink. She could still drink, but she hadn't had any food in her system. So on her advance directive, she had said that she would try artificial nutrition and hydration. So in the ICU, the nurses came and said, they said, okay, we understand you'd like to try this. And so what they did was they did what's called a nasogastric tube. The tube is the way that they deliver the nutrition to the body. In order to place the tube in the ICU setting, they will go up the nose, down the throat, into the belly. And this is how you place a tube for the artificial nutrition. Well, mom, the first time that they put it in, she immediately said, get it out, it hurts. They said, okay, we'll try it again. They thought maybe they didn't place it right. So they came back in a few hours later, they put it in. They didn't even start the fluid, and she said immediately, get it out, it hurts. Okay, we'll try again. So the third time that they came in, she said, get out of here, I don't want that. Well, I needed to make sure she understood what that meant. And she did understand that by not having the artificial nutrition, she was on her way towards the end of her life. And so she did understand that. But keep in mind, this is something that you can choose. If you decide that you want to have a temporary tube feeding, remember, if they put it in, if it's temporary, that means you're agreeing to take it out after an amount of time. And sometimes that can be challenging for loved ones to witness. So artificial nutrition and hydration is a personal decision. It's something that you can choose for yourself so your loved ones don't have to decide on your behalf. They will always try to give you food by mouth. So keep that in mind as well. It is a personal decision. In some illnesses, it can actually prolong life. People have lived for many years with a permanent tube feeding. In other situations, it may not actually prolong life. It may actually exacerbate the dying process. A dying body actually shuts down and it doesn't need fuel. So if you think of food and nutrition as fuel, as a person is dying, it no longer needs that fuel. So it is a personal decision. It is something that you should really consider and express, or at least document it on your advance directive so that your loved ones know what your preference would be. For pain relief, pain medications, it really is a personal decision. Some people say, no, I don't want pain medications because I want to be awake and aware. And in other cases, people say, yes, I'd like pain medication. Again, this is your personal decision. And it's your opportunity to tell your loved ones so they don't have to guess whether you would want pain medications. And this part is usually the one that makes it a little bit challenging for people. People sometimes have a harder time saying what's important to me. These are where you want to make sure that your loved ones know what makes life meaningful. They know what you consider to be a good quality of life. And if you're asking for a trial support, how long would you want? This is also the part of the document where you can say when you would like to stop treatment. And this is where it's all in your words, what you would want, what you wouldn't want, and what you want your agent to know so that they are making the best decisions on your behalf. And in order to make this document legal, it needs to be signed by a notary or 2 witnesses. The 2 witnesses, they must be over the age of 18. It cannot be the person you've named as your healthcare agent. It cannot be someone you are receiving medical care from. So whether you're in a facility, it cannot be an employee of the facility. It needs to be someone who is not providing care for you as well. One of your witnesses cannot have they cannot have inheritance rights. So oftentimes people think the notary is an easier way to go. Sometimes 2 witnesses is easier. It just depends on the situation, but either way is fine with making this document a legal document. what is POLST? So I'm going to invite you, if you have questions on the advanced directive, feel free to put them into the Q&A and we'll address this at the end. We're going to move on to the next document, which is the POLST. It's the provider's orders for life-sustaining treatment. This is a bright green form. Oftentimes you'll see it on the refrigerator. Sometimes it's taped to the wall. Who would benefit from having a POLST form? So this is a specific demographic. These are people with a chronic or progressive illness, people with a serious health condition, people who are medically frail. The question is, would you be surprised if this person died within the next year? And if the answer is no, I wouldn't be surprised, and they're probably a good candidate for the POLST. This is also for people who say they do not want resuscitation. Now, I want to invite you, if you folks have been handed a POLST because you're of a certain age, push back and ask, why are you handing me this? Do I have a health condition that I should be aware of? Oftentimes it's being handed out to the wrong demographics, or they're looking at just because you're age 65, they're handing these out. We would like to combat that by saying, okay, when you get one of these, if you don't fit this profile, ask your doctor, can we have a more in-depth conversation about advanced care planning, because I don't think this document is what I need. Or you can say, hey, I have an advanced directive, let me give you that. Again, we want to make sure that the POLST is being used well, and also that it's being dispersed into the community well, to the right people. So the POLST, a little bit of history on it. It was first introduced in 2009. We updated it in 2014. It started as the physician's orders for life-sustaining treatment, but now it's the provider's orders, because it can be signed by either a doctor or an APRN. It's very straightforward. It has the individual's name. It also has an emergency contact on the back of it. The first question on this form, and I will invite you to think about this, put your thinking caps on. If a person has no pulse and is not breathing, what are they? Person has no pulse and they're not breathing. If that person has been found with no pulse and is not breathing, Debbie, you want to chime in? What is it? You can guess, it's okay.
Okay. That they're dead?
Yeah. 10 points.
I don't want to say the wrong answer.
It's okay, but that's what it is. The first question on this document is, if you were found dead, do you want them to attempt CPR? Now, I will tell you, if you have a POLST form up on the refrigerator, on the wall, whatever, this is the first thing that they're going to look at when first responders come in. If the person is non-responsive, they're going to look at this form and say, do we attempt CPR? So a little bit about CPR. CPR was not meant for the elderly. It was meant for a cardiac arrest kind of thing. So it's not an attempt to prolong life. CPR, if you've ever seen CPR done on an individual, it can be quite a violent act. In order for CPR to be effective, you actually have to push into, if you'll take your thumb and your first finger and go 3 inches apart, that is how far that the person who is doing CPR needs to push into the chest to be effective. So again, I invite you to take your thumb and your first finger and make 3 inches. In fact, here's a ruler, 3 inches. This is how far they need to go into your chest. They need to push into your chest in order to be effective. Now, in order for them to be effective, that means that there's a bone. If you feel right here in the middle of your chest, there's a bone, there's a breastplate. In order to hit that 3-inch mark, sometimes they have to crack a few ribs. So again, it is not necessarily meant for the elderly and the frail. A 70-year-old who has CPR has an 11% of chance of recovery. Now, an 80-year-old who gets CPR, a 3% chance of recovery. So while it's a great thing to help with saving lives, it's not necessarily explained well so that people know what to expect from CPR. So again, CPR, it's a personal decision. We either attempt CPR or we allow for a natural death. They sometimes use the acronym DNR, which is do not resuscitate. I prefer to say allow a natural death. So we either attempt the CPR or we allow a natural death. This is the first section on your POLST. The second section is at what level of intervention would you like us to provide care? And I apologize that it's a little bit blurry, but there are 3 different levels. There's comfort measures, there's limited additional interventions, and then there's full treatment. And what those look like are quite different. Comfort measures, we're saying, hey, we don't want any medical intervention. We'd like to stay home. We prefer not to be in a hospital setting. Limited additional intervention are saying, hey, I'm okay with doing some things, but I would like to stay out of the ICU. Full treatment is let's try everything possible, which could include a stay in the ICU. So these are the 3 levels of care that are discussed on the POLST. This is the second section. Now, keep in mind, if you decide that you would like CPR, if you would like them to attempt CPR, then you have no choice except to go with full treatment, because it makes no sense for us to bring you back to resuscitate you and not give you the support that is medically required in order for you to try and recover from this event, right? So if you choose that you'd like them to attempt CPR, then we're going to choose full treatment. If you say, let's allow for a natural death, then you have these options: comfort measures, and then limited interventions, or full treatment. You can choose which level of care you would want. The next section is on artificial nutrition and hydration. Again, we're coming back to this, right? Food is love. Again, we're going to always offer it by mouth whenever it's feasible. But this is an opportunity to say, hey, I would like it, I wouldn't like it, or I'd like it for a limited amount of time. And I'm going to define what that amount of time is. And in order for this document to be legal and to be honored by medical first responders, you want to look at having the signatures. And the most important one is the provider signature. So whether that's the APRN or the doctor, as well as the patient. So as long as the person who's this POLST is for, as long as they're able to sign for themselves, we encourage them to sign on their own behalf. If it's not the individual themselves, then you're looking at one of these different legally authorized representatives, which could be a patient designated surrogate, a surrogate by consensus, a guardian, parent of a minor. We just don't want the person who's taking the individual to the doctor saying, oh yeah, I'll sign for them, because that's really not the person who should be doing this. If there's an advance directive, that person named as the agent really should be the person who is signing the document if the individual is not able to sign for themselves. Some practical decisions, practical considerations is that this should be saved on the refrigerator. A copy is as legal as the actual green form. People will talk about having a POLST in the purse because they go out into the community. A reminder with that is that if you should have an event, emergency out in the community, they will take your purse with you, but they might not necessarily look in your purse before providing aid. So it's something to consider. The POLST is actually a portable document, so it should go with the patient from setting to setting. Some differences between the advance directive and the POLST is the advance directive, it's meant for everyone over the age of 18, whereas the POLST is meant for that specific demographic that we talked about earlier. CPR is not addressed in the advance directive where it is in the POLST. Advance directives, while they're very helpful, they cannot be followed or honored by EMTs. So while you may have an advance directive, excellent, that will not be something that will stop an EMT from providing support or services or health, taking action while the individual is outside of a hospital setting, but they will take the advance directive with them. With the POLST, that is something that EMTs can honor. So where does the POLST fit in? if you take a look, the advanced care planning continuum at age 18, let's start getting people doing their advanced directive while they're updating periodically. And then once there's a diagnosis, that's when we can look at a POLST form so that we can ensure that wishes are honored. We encourage you to review anytime there's a change in clinical condition. It is an opportunity to communicate with EMTs your wishes and in a simplified way so that they can honor that outside of the hospital setting. The POLST conversation, again, this is not something that should be mailed out to you. This is something that you should be having a conversation with your provider because it actually gives an opportunity to ask questions, but it also helps to identify goals of treatment. The POLST conversations, it really is an opportunity to change the question from what's the matter with me to what matters to me. And having these conversations, not only with your loved one, but also with your provider, it gives them the opportunity to ensure that your wishes are documented in your EMRs so that other providers can also find that and have access to that. I'm just gonna jump through this really quickly because Debbie mentioned Navient's integrative care. This is equivalent to the palliative care, and we are encouraging folks to utilize and access this type of care early because it's actually a great opportunity to provide that extra layer of support, not just for the individual facing the serious illness, but also for their loved ones. And they can continue to get curative treatment. So Navient's program is called Integrative Care. Other programs, other systems, they have their own names for it. Health plans, HMSA calls it supportive care. UHA calls it concurrent care. The VA also calls it concurrent care. There are many names, but basically this is what the service is providing. So if you are faced with a serious illness, we encourage you to ask if you would qualify for this type of care. Hospice referrals. Of course, we know that hospice is someone needs to have a prognosis of 6 months or less to live. It's a team approach. I call this the Cool Kids Club for Mom because she got a physician, a social worker, an aide, a spiritual advisor. And she got this whole team of people working towards supporting her at the end of her life. So we do encourage early hospice referrals so that folks get this support longer. You often hear about people who have this type of support with hospice. Oftentimes you'll hear about, oh yeah, my friend graduated. That's because they got better. They got the support that they needed and they got better from having that additional support. So we do encourage folks to ask for hospice early, ask if they're a candidate for hospice. If you're not sure, you can always call the hospices directly. Folks at Navient would be happy to give you an answer, whether that person would qualify, and they'll do the legwork on as well. I'm gonna jump past this to our second poll because we are at almost at our very end. If you can bring up that second one, Debbie. So again, these two questions, every competent individual over the age of 18 should complete an advanced directive, true or false? And then the second one is everyone over age 18 should have an advanced directive, but not everyone needs a POLST, true or false?
Okay, another 10 seconds, and I will share the results.
Thanks, Debbie.
You're welcome. Okay.
Okay. So yay, everyone, for the first question, yay. And then number 2, everyone should have an advanced directive, but not everyone needs a POLST. That is true. So again, that POLST is intended for people who have chronic illness, serious illness. Maybe they're frail, they're medically frail. It is determined for certain demographics. So great job, folks, with the POLST and the advanced directive and what is what. So I encourage you to visit us at our website, kokuamau.org. We have all these different resources that are available for you if you have further questions or if you want to look further at the documents themselves. They also have translations into 10 different languages. So folks can, if they have someone who would benefit from seeing this in their own language, they could actually download that as well. We invite you to join us, either become a member of Kokua Mau, join our mailing list, which is free. All the materials that you've seen, they are free to download. We encourage you to use the translations, share your stories with your loved ones. If you had a good experience, by all means, we hope that you will share that. We do offer our Kokua Mau Let's Talk Story program, which you've just sat through. We are happy to talk with your church, your book group, your senior club, whatever organization you think would benefit from having this. We do this for the community, and we're happy to set up a Zoom for you. So you can feel free to reach out to me. This is my information. I'm happy to coordinate with you as well. And thank you all.